All right, so for the sake of time, we'll go ahead and get started here. We want to make sure that pizza's still warm. My name's Dan, and we also have Tiffany here.
Hello, and we are part of your client success team here at HealthiestYou.
So we're really excited to present to you about HealthiestYou and why it's a part of the All Savers plan. Today we're going to go through the benefits, how a lot of our current clients are using the product and redirecting a lot of claims away from that All Savers plan. And then we're going to learn a little bit more about our smartphone technology. So if you have any questions throughout the webinar, please feel free to use the questions tab. It's going to be on the right-hand side on that Go to Webinar tab. We're also going to ask a question. At some point through the presentation, we're going to ask a question, and the first person that answers it right will win a $25 gift card, so we really want you to be engaged, watch the webinar. We might have a quiz at the end, we'll see. But what our main goal is with HealthiestYou is to reduce health plan claims and simplifying the way you access healthcare. So we're going to kind of look at some history and how some other companies have paved the way in their own space. TiVo, what they did was actually shift time, right? You didn't have to rush home in that traffic to watch that movie or that TV show. It could be recorded. While Google, they were actually able to make it so you can go and see information anywhere, right? You can access that on your smartphone, online, or simply even just calling in Google. Or also Uber. So Uber brought place shifting around. So what this is transportation has never been easier now with Uber, right? So we really want to do this with healthcare, and HealthiestYou is going to be more healthcare shifting. So I want everyone to kind of think the first time you heard about these three things, TiVo, Google, and Uber, and HealthiestYou is already a part of that All Savers plan, so we really want you to share with your employees about this new benefit, just like the first time you heard about these other three. So what is HealthiestYou? So we're going to go through all the benefits today, what the product is, and again, why it's part of the plan. So more about HealthiestYou. It's not just telehealth, and we're going to look at some statistics here in a second, but if we look at this little stick figure here, we'll see that there's prescription savings, there's health management, there's 24/7 access to doctors. So we have 2,300 doctors waiting for members to call in when they're not feeling well, and we're redirecting those claims away from that traditional All Savers insurance plan. There's also capabilities to locate providers in your All Savers plan that we'll look at here shortly. So I'm going to turn it over to Tiffany, and she's going to talk about some statistics here.
Right, so this all sounds great, but let's talk about why you really do need HealthiestYou. Here's a quick study by the Wellness Council of America that over 70% of all ER, urgent care, and doctor office visits can actually be handled safely and effectively over the phone. That means that 7 out of 10 times you could have just called HealthiestYou, right? But instead, what do? Let's take a look. Step 1, we're not feeling great. We're probably going to try to connect with our primary care physician. Yeah, we have kind of a big copay, but we really like them and maybe they can treat us. Well, that sounds great, but actually in 2014, the average patient had to wait 18 days to see their primary care physician. Well, before day 18 rolls around, we've probably taken a different route, right? So what's our next step? We're going to head on over to that local urgent care. However, you do see a higher average visit fee here, not to mention the wait time. If it's not super urgent, you're probably going to be waiting around a while, and an even bigger claim is going to be filed. But again, with urgent cares, we do see availability is limited. What if it's late at night? Let's say that urgent care is closed. Where do we go next? Our last resort is going to be the emergency room. Nobody wants to end up in the emergency room. Obviously, we see a $1,200 average visit fee, and not to mention you're going to be waiting in that room with a bunch of other sick people, and a huge claim will be filed. And I know you're thinking, but at least they're available 24/7, 365. Well, guess what? So is HealthiestYou. This is a benefit that is given to you through this All Savers plan, and it's something that you should all be utilizing. Always, always start with HealthiestYou. This is something we really want to communicate to all of your employees, right? We see no consult fee, no wait time. Pick your own waiting room, whether it be work, you're on the couch at home, maybe you're on vacation, and no claims going to be filed with that All Savers plan. And again, we're here for you 24/7, 365. So let's take a look at the top 9 reasons we do visit the emergency room, and these are actually also the top 9 reasons that our members call HealthiestYou every single day. You see allergies, earaches, strep throat. These are the kinds of things we can almost diagnose ourselves, right? Excuse me. We know when our child has pink eye, we know when our sinuses are acting up, but still we end up going to the doctor because we don't really have an alternative option. Well, now you do. Go ahead and give HealthiestYou a call. So Dan, who am I talking to when I call HealthiestYou?
Great question. So all of our doctors are NCQA licensed. They go through a strict NCQA certification process. On average, they've been in practice 15 years. So these doctors have all that experience and expertise. They can diagnose, treat, and prescribe. So our number 1 prescribed prescription last month was actually amoxicillin, followed by Z-Pak, followed by Lipitor. So these members are calling in, getting their symptoms addressed, and getting that prescription sent over to the pharmacy of their choice. And again, there's no claim back in that All Savers insurance plan when a member starts with HealthiestYou. There's also available 24/7, 365. Services available in 48 states, so if you're traveling, you can always connect with a physician. You're away from that primary care or simply just out of the current location that you reside in. And again, our doctors can handle over 70% of those issues face-to-face over the phone. So we're going to walk you through the member experience of what it is, what's it like the first time you call, right? You can actually go online, schedule that consultation. You can either use a smartphone application, or we have an 866 number that you can call and get connected with a doctor, and we'll look at some surveys number here in a bit. But we're going to ask you to actually provide your medical history the first time you go in, and we really recommend groups to do this to make sure people are registered and they're providing this medical history prior to getting sick at 2 a.m. or even 2 p.m. But providing medical history, it's going to consist of that simple one-page document that you fill out when you go to the doctor's office. Things like, what am I allergic to? Am I currently taking any medications, and so on. At that time, we're also going to ask you to select the pharmacy of your choice, and you do have the opportunity to select your primary care physician so we can share those notes concluding the consultation. You'll see here that the call is scheduled with the appropriate doctor. So more about the appropriate doctor, as I mentioned. If you're traveling, please feel free to use HealthiestYou. You can always change that pharmacy so our doctors can prescribe to your current location. And then more about the appropriate doctor. We have 80% of our doctors are ER doctors. The rest are going to be sprinkled in specialty doctors, ear, nose, and throat doctors, OBGYNs, pediatricians. We have members calling in every day on behalf of their child for the pediatrician care. Once that call is scheduled, the doctor is going to actually review that online patient history and give you a call back. During that consultation, the doctor is going to walk you through all the symptoms and send over the prescription to the pharmacy of choice. Obviously, if the doctor can't prescribe something over the phone, they're going to redirect you in the right care. And we'll look at some survey numbers on that. Concluding the consultation, as I mentioned, if you want to share those notes with your primary care physician, you can do that, and we will share those following the consultation, and they'll also be in the online portal. So I'll turn it back over to Tiffany since she's the statistics girl.
That would be me. All right, so let's take a look at some numbers. So 97% of our All Savers members were satisfied with their HealthiestYou experience. 94% of those actually had their medical issues resolved. That means they didn't have to take any further action. And this is within an average callback time of 9 minutes from a doctor. So if you think back to those other healthcare options, whether you're headed to your primary, your urgent care, or that ER, it's probably going to take you at least 9 minutes to get there, right? Let alone actually be speaking to a doctor. We have an average consult time of 13 minutes. And 51% of our calls take place from 9 to 5, Monday through Friday. Why? Because we have a lot of members who don't want to leave work to go to the doctor for those little things. We know working is important, right? But so is being healthy. And thanks to All Savers, you guys have this available to you for 0 consultation fees. So you can call from work, you can call from anywhere. This is always available to you. So let's take a look at the smartphone app. Basically, if you have HealthiestYou, you should also have the app, right? They go hand in hand. Not only do we want our members downloading this because they can connect to a doctor directly from the app, but there are also so many other tools within this app that your employees can utilize. You see we have prescription savings, we do geofencing location, you can find in-network providers for those times when you really do need to go see a doctor. This is available on the App Store as well as Google Play, and you can locate it by searching HealthiestYou, and that's going to be all one word, no space in the middle, HealthiestYou. Very easy to set up the app, right? You open it up, you do have the option to personalize your family tree for those dependents that may fall under you. You have the option to get everybody a cute little picture there if you'd like to customize it. But the most important part here for your All Savers members is to sync that health insurance plan. You can do this under settings. You simply click insurance. All you need to do is pull out that All Savers card and enter your member ID and then select the appropriate insurer. And by doing this, it's really going to open up all of these other tools that are so great. One great feature of the app is the geofencing reminders. So if you are in an urgent care, we're going to take a second, then we're going to remind you, hey, wait, are you sure you want to pay that big copay when you could be talking to a HealthiestYou physician for free right now? And with a little luck, you will click Connect Now and speak with one of our doctors and walk out of that urgent care without spending a dime. So not only have we done that with urgent cares, but we've also done it with pharmacies. As we mentioned, all of our members have access to these prescription savings. We don't want you overpaying for your medication. So if you're in a pharmacy, we're also going to remind you, wait a second, make sure you do your research. You have prescription savings through HealthiestYou. So we geofence those pharmacies as well as another benefit reminder for those All Savers members, because there's another great way to save money and redirect those claims. Here's a great example of the prescription savings within the app. You can see here we have Lipitor. We're going to base it on your location, tell you where it's cheapest in your area, and this tool can actually save you up to 85% on your prescriptions. And 70% of the time, we're actually beating that insurance copay as well. So this is a great way for members to utilize their HealthiestYou benefit. Just make sure they're getting the best deal, and a lot of times it is going to be with that cash price. Therefore, no claim has to be filed. So let's take a look at how easy it is to schedule a telehealth consult within the app. Essentially, you open up the app, start here. What do we want to do? In this case, we would like to talk to a doctor. You're going to want to choose the appropriate family member. So who needs help? Is it me? Is it my husband? Is it our daughter? You'll click the right number and we will connect you to care directly from the app. Simply click Connect Now, and it is that easy. All right, look alive, people. It is time for our surprise question of the day. So if you know the answer, don't forget to submit it in that questions tab, and the first person to get it right is going to win that $25 gift card. Drum roll, please, Dan. Thank you. What percentage of doctor office visits can be handled safely and effectively over the phone? I don't know, Dan. That's kind of a tough one.
All right. Looks like we had an answer here.
Let's see.
Perfect. So the winner is going to be Melissa O. We'll follow up concluding the webinar. There was about 8 people that put it in first, but thank you again.
Melissa, you're so quick. Congratulations. Fabulous news. That is true. Over 70% of those doctor office visits, so don't forget to take advantage of these benefits, you guys. All right, so let's say we do need to see an in-network doctor for those other 30%, right? We are actually going to connect you with an in-network physician, so keep in mind this is why we want you linking your All Savers plan. We're going to connect you with an in-network doctor or a specialist based on your location and based on your in-network plan. So sometimes, let's be real, you know, going to a new doctor can be kind of sketchy, right? We don't know about that bedside manner. We're actually going to give you a little bit of background on your doctor. So not only can you find a physician, but you can also access biospecifics, you know, what languages do they speak, where did they go to school, but you can also see rankings from other patients. What did other people think? Does this sound like a doctor that you're going to like? So it's a really great feature in the app as well that your All Savers members can be using. And then one last thing here is the procedure pricing transparency. So we are actually going to help you save money on those procedures as well. Again, this is based on your network, based on your area. You see a great example here of an MRI. We're going to give you the average paid, the average submitted. We've all been there when we get something done, we just dread getting that bill in the mail. But with this pricing transparency, you don't have to worry about it. You had your HealthiestYou app, you did your research, you found the cheapest place, and you don't have to worry about that bill coming in the mail because you already know what it's going to be. So that pricing transparency is also a great feature within the app. So Dan, let's talk a little bit about utilization.
Perfect, thank you. So we really want people to start with HealthiestYou, and we've kind of pioneered through the telehealth space with members starting with HealthiestYou when they're not feeling well, and really to educate all your employees and really share with them that if you're not feeling too well or if it's not too serious or an emergency, it never hurts to start with HealthiestYou. So we're going to go through some case studies, and this is actually one of our current clients that is going to be a little bit larger than your typical All Savers plan. But I really wanted to share everyone that here on the left-hand side, we'll see that the number of people that files claims went down 36%. So a lot of our groups that chose the All Savers insurance plan chose it because you pay monthly like a fully insured plan, but it has all the benefits of a self-funded plan, right? If we redirect those claims away from that All Savers insurance plan, then you're more likely to get that surplus back when you renew at the end of the year. As we see here, the claims went down actually 39% with this group, while the payments went down 37%. So this all equaled about $30,000 that this group saved by starting with HealthiestYou and really trying to change that culture and that behavior within the company. As we see here as well, 2.2 fewer PTO days. So this company with 146 lives, that almost equals a year's worth of PTO days. Think about how much more productivity is getting done in the workplace there. Now these are actually going to be case studies that are our current All Savers groups that started around the same time as you. As we see here, they're utilizing the benefit, right? They're really trying to change that behavior, starting with HealthiestYou, really keeping people present at work instead of leaving for that time-consuming experience, whether it's at the urgent care or ER. And if we take the average cost of visit, which is going to be roughly $500, and that's combined with urgent care, ER, and primary care, these groups are saving a substantial amount of money not dipping into that claims pool. So we'll see two more case studies here. One, 71 lives, and they're really using the benefit, right? Look at all these consultations throughout each month trying to change that behavior. This group, 44 lives, and all these groups that are utilizing the benefit, they're more likely to get that surplus back, right? It's money back in the employees' pockets because they're not paying these copays. They're not taking PTO days or sick days, and then it's money back in the employer's pocket as well because they're getting this surplus back, right? The money's not being pulled from the claims pool, and again, if you renew, you're more inclined to get a check back. We all like getting checks back, and this typically doesn't happen with healthcare, right? We typically don't get money back from our healthcare providers, and with all these other pricing, prescriptions, and procedures, we're really bringing consumerism to healthcare. So two things that you typically don't put together is consumerism and healthcare, right? So we're really trying to change that behavior, and we've done that by creating all these platforms that you can access HealthiestYou on, whether it's dialing with the old smartphone or even the smartwatch. You can still connect with the doctor. Also the smartphone, the tablet, as well as scheduling that appointment with a computer. Soon, sometime in Q3, we're actually going to roll out our Couch Care initiative so members can go on, have that face-to-face visit at home from the comfort of your couch and not have to leave if you're not feeling well. So we're going to go into some Q&A. We've had a couple questions here as we've gone through the benefits, so we'll go ahead and go over those right now. So the first question, great question. Do we have Spanish-speaking doctors? Yes, we do. We have Spanish-speaking doctors in the available 49 states. We also have our smartphone application that is available in Spanish. So when you're going in, setting up that smartphone application, feel free to change it from English to Spanish. All right, another great question. So A member looked like they were trying to download the app already and you couldn't find it. So if you go on Google or the Android store, you can search HealthiestYou, all one word, and you'll be able to find that. There's no space, or you can search HY. Again, it is available in the Apple App Store along with the Google Play Store. All right, looking at some questions here.
Okay, another great question here in reference to the app. In the event that you have registered online, you also need to register within the app the first time you log in. So if you've downloaded that app and you're simply trying to click log in because you know you've registered before, we're going to need you to click register in the app as well. That's not going to create duplicate registration. That's basically just going to tie your two accounts together and register you in the app. So if you're having trouble with that login, it's simply because you just need to register through the app as well.
All right, we have another great question here. So can the app be downloaded more than once? Absolutely. So if you have a spouse and dependent that wants to use a service and they're on that eligibility we receive from All Savers, they'll go in and they'll actually verify the primary member's information. So that's going to be the last name, date of birth, and zip code that Tiffany just spoke about. Great questions coming in. Looks like we got a couple more here. It shows custom webinars. So we're going to go into that. Great question, great segue. So yes, we've had great success with our groups. Those utilization reports, we've actually had the opportunity to work with the group and doing custom webinars to really explain to all the employees about this valuable benefit. We've seen great success when we're able to educate everybody all at once. So as we see here on the slide, we do custom group webinars. We do custom marketing pieces. So please feel free to email us at clientsuccess@healthiestyou.com, your logo. We'd love to send over some digital marketing pieces to share that with your employees. We love sharing success stories with employees, so if you have one, please feel free to send it back to us. You could go to www.tellhy.com. And then concluding the webinar, we're going to ask a couple survey questions, so please feel free to look at that. Looks like we have a couple more questions coming in here.
All right, so are employees that are not on the group plan eligible for HealthiestYou? As far as HealthiestYou with All Savers, we are embedded in that All Savers plan. So unfortunately, any employee that is not a part of that All Savers plan is not going to be able to utilize the HealthiestYou benefit.
Great point there, Tiffany. So we get all the eligibility over from All Savers. We've had a couple groups that actually elect to come to HealthiestYou, work with your broker, and we'll be able to get everybody on. I know I personally worked with a group over in Georgia that was able to offer this to all their employees, even not on the All Savers plan. There will be a cost incorporated with that, unfortunately, because All Savers is picking up that monthly cost, but it is such a valuable benefit for everybody in the workplace to have. So great question there. So how can you know if your employees are using HealthiestYou? Feel free to reach out to us. We could pull a utilization report quarterly and provide that back to you. So we could do different marketing pieces, right? So if they're not using it, maybe we could work with you. Please feel free to email us. Our contact information is right there, or feel free to contact your dedicated account manager here at HealthiestYou. Looks like we have a couple more questions come in here. All right, another question. So the doctors are able to prescribe over the phone. Yes, absolutely. So as we were going through those utilizations, these members were actually getting those consultations, getting prescriptions sent to the members over the phone. As we also saw earlier, that when I mentioned that our #1 prescribed prescription last month was amoxicillin, followed by Z-Pak, and followed by Lipitor. So these members are getting their issues addressed safely and effectively over the phone. And again, from that question that we asked, it's going to be 70% of those face-to-face visits that we really want members to start with HealthiestYou. And the reason behind that is because there's no claim in that All Favors insurance plan.
Okay, one other great question here. What materials do we have that we can send out to the employees to let them know how to start using it? This is something that we'd love to talk to you about one-on-one. It just depends on what way you communicate with your employees. Generally, we have flyers. We do have a Spanish flyer as well. We have a few different things that we could use. One really effective thing that we like to send out is a custom webinar for the group. Essentially, 10-minute overview of the HealthiestYou benefit that's company specific to give them a good idea of their benefit and what all it entails within that All Savers plan. So there are a lot of different things that we can do for you. So we'd love to discuss that further, and absolutely send a request to Client Success, and we will be in touch with the best way to communicate with your employees.
Perfect. So we'll stay on here for a little bit longer. If anybody has any questions, please. Oh, looks like a couple just came in, so we'll answer these right now. So great question. Is the custom webinar put on by HY or the admin? So we'll actually come on, do a webinar just like this, and we've had great success with companies getting everybody together in a conference room, or even have everybody sign up for the webinar and walk through that benefit. We could do registration reports to ensure that everybody registers and attends the webinar. So we can get creative as well, make sure everyone signs up. We could send gift cards out to ensure that registration and kind of incentivize that. So we could definitely get creative and kind of change that behavior. Perfect. So concluding the webinar, we'll actually send out a recording so you can share that with your employees. We can also send over the PowerPoint that we used today. We definitely want share this with your employees. We've had great success with companies that are sharing their stories within the organization, sharing their stories with us here at HealthiestYou, sending them to www.tellhy.com. And then we really want to thank everyone for taking time out of your day. We appreciate being a part of the All Savers insurance plan, and it's such a valuable benefit to redirect those claims, not only for the employer group, but also for the employees. If anybody has any additional questions, please feel free to reach out to us at clientsuccess@healthiestYou.com. And don't forget to take the survey concluding the webinar. We want to learn from this so we can create other success stories with your organizations and with other companies that have the same insurance plan that you do. Again, thank you. We'll stay on here, answer some additional questions over time. So again, thank you everyone for attending the webinar.
Thank you so much for joining today. It's our job to make your job easier. So if there's anything at all that we can do for you, please don't hesitate to let us know.
All right, it doesn't look like any additional questions. Again, thank you everyone for taking time out of your day. We greatly appreciate you attending the webinar. Enjoy the rest of your day, and if you have any questions, please feel free to reach out to us. We're here to help. Thank you again.